Hi all, and welcome to the May installment of our virtual CDub Classics presented by Kaiser Permanente. CDub Classics provides monthly health and wellness activities to Santa Cruz County residents. My name is Alyssa Beaton, and I'm the Public and Community Relations Supervisor with the Santa Cruz Warriors. Today I'm here with Santa Cruz County Psychiatry Clinical Manager Rick Galvin as we discuss mental health and celebrate May's Mental Health Awareness Month. Rick, thank you so much for being here today. Before we get started with the Q&A, I was just hoping you could give viewers a little insight into your background and kind of the day-to-day operations of your role.
Sure. So first of all, thank you for having me. My name is Rick Galvin. I'm the clinical manager for Kaiser Psychiatry here in Santa Cruz County. We opened here locally in Santa Cruz County about 4.5 years ago. And so I was with Kaiser San Jose for 2 years prior. I've been a long-time Santa Cruz resident, 20 plus years. So it's been a great honor, a very humbling task to be able to, kind of launch a psychiatry department here in Santa Cruz. This is something that hasn't really been around at this level for quite some time. So we're very excited to be here, and I'm really proud to be serving my community. My day-to-day operations, typically I'm seeing a lot of patients, quite frankly, individuals, adults, children, families, and in between those times, I'm doing it, real fun administrative things like trying to hire, staff and again build a program. So we have clinics in the southern end of the county in Watsonville, which is where I'm typically headquartered my own self, and then we have the clinic in the northern part of the county up in the Scotts Valley. And so I refer to us as a small but mighty team. San Jose Kaisers are, again, our mothership, and so we rely very heavily upon them for support and resources too. But every day I'm seeing patients and again, just trying to build a program and make a Kaiser a strong presence here.
Awesome. Well, thanks for being here. We definitely appreciate all you're doing to support the Santa Cruz community as well. And with that, I think we can just hop right into our Q&A that we have.
Sure.
So as we all know, the conversations around mental health, stress, anxiety, depression are only continuing to increase, especially as a result of the pandemic and COVID-19. Can you talk a little about the stigma of mental health and how we can all overcome that?
Sure. I think there's actually been a few silver linings to COVID-19 and the things that we've experienced, being able to do, meetings like this, for example. One of the silver linings that may not initially seem like a silver lining is that, yes, mental health issues have obviously, boiled to the top. And so people who might historically have been hesitant, shy, insecure, embarrassed about seeking out mental health care are now seeking out mental health care. And I think that every human, every organization tries to survive and cope with things in life as best as they can on their own, using their own kind of natural personal resources. But we're human, and everyone's got their bending points, hopefully not breaking points. And so, reaching out for help has suddenly become okay to do, largely out of desperation, right? And so we're glad to be here. We're glad because we've kind of been waiting. We've been here for a long time. So I think necessity has kind of forced some people who might not normally have, and in so doing, I think there's been a really positive domino ripple effect where other people have noticed, like, oh wow, you're kind of talking to someone and kind of taking care of yourselves in ways that we traditionally wouldn't have done within our family or culture. Maybe there's something to it. And so there's been sort of this like really positive, grass fire where people are like seeking out more help because they see their colleagues and their friends and family and loved ones doing so. So it's really opened up some doors, really opened up some barriers and demystified things that mental health care is just as important as primary health care.
That's great. The domino effect that you mentioned, that's just great that, people talking about mental health is bringing other people to go get those services that they might need.
Absolutely. We're really glad to have that kind of word of mouth.
Totally. And as you mentioned, we've learned that mental health is just important as physical health. Can you talk about the importance of mental health and how it affects our overall well-being?
Sure. I think that, it's the yin and the yang. They are part and parcel. And, I'd like to believe that the most, powerful, important organism or organ in our bodies is our brain, right? And in our brain, that's where the mind lies. And so, healthy mind, healthy body, healthy soul, healthy spirit, it's all connected. But, I think that having our sanity, if you were to ask most people, would you rather have, an incredible physical health or sound mind? Most folks might opt for sound mind. And these are times that have been so taxing that even the most, reasonably, rational and well-grounded people, have been struggling. And so, while we can still, work out our biceps and go jogging and cycle, we still have to take care of our mind, because that's what ultimately governs our moods and our emotions and our decision making and our judgment, and our ability to take care of others. So it's super important to be able to take care of our mental health and our well-being right up there with our bodies.
Right. And there certainly is crossover in terms of getting out for a walk. You're working on your physical well-being, but you're also helping your mind and getting out and getting some fresh air.
I say it all the time to people. I blatantly steal the Nike slogan around "Just do it," and kind of fake it till you make it. Just get out there, ride that bike, and you'd be surprised what ends up happening about how good you feel afterwards. Just the personal pride, like, hey, I did it. I was kind of dragging my feet to get into the gym, but I feel so much better now that I did.
Definitely. So what are some tips that you can provide to help manage stress and anxiety, maybe in the short term?
Sure. I think being mindful, it's an incredibly important skill, I would argue, because not everyone, can kind of access that part of themselves to be able to be like fully aware of what's going on for themselves at one given moment, whether it's how their breathing might be, how they might be carrying their tension in their back or their lower back. So I think one tip, one sort of immediate thing, is to be able to sort of like hit that pause button and just do a little, biofeedback. Like, do I feel like I'm carrying some tension somewhere in my neck and in my legs, in my tummy? That's probably the most important. If I'm sensing some stress or some angst there, what do I need to do to relax it? I think some of the other most important things are those fundamentals, eating right, sleeping right, proper rest and nutrition. We can't emphasize enough the importance of those two things. That's our gasoline, resting and nutrition. That's what keeps us going.
Great. And then looking more long term, what do you think are some strategies or actions that we can take to improve our mental health?
I think, physical exercise is a huge thing. I'm a big fan of breathing exercises, diaphragmatic breathing exercises. You can do a simple Google search on, breathing exercises. There's no shortage of those. And I think staying connected to people, so much talk about social distancing, and I think that refers to the physicality of it. But I'm a fan of, still staying socially connected. And so I think long term, we really, I think, have been able to appreciate just how important social contact is with people, and hugs and all that really kind of very nurturing thing. So long term, through this pandemic, I think we've learned the importance of staying socially connected to each other. I'd still like to plug the importance of mental health services. So, being able to utilize a psychiatrist for medications if ever necessary, a therapist to be able to talk to someone. There's so many things long-term that can be done.
Yeah, that's a good point. I know you mentioned the social aspect of it, and I got to see my grandma yesterday for the first time since the pandemic, and now that we're both vaccinated, and she gave me a big hug, and it was definitely a very emotional experience.
It's huge. It's so huge, the power of the hug, and we've taken this stuff for granted. And absence makes the heart grow fonder. It's a cliche for a reason. And if ever that cliche was proven to be true, it's been the last year and however many months.
Totally. Can you provide some ideas on brief, less than 5-minute interventions to help boost mood?
Sure. A hug, right? being able to just like smile at someone and making someone else feel good. That takes, you know, a nanosecond to be able to do something like that. The breathing exercises, again, just stretching. Food, you know, we don't want to misuse food, but it feels good to, you know that we're eating right. Exercise is also something. I think that we can boost our moods, you know, by boosting other people's moods too. And that kind of speaks to the importance of that social contact. There's other things that can be done by way of psychotherapy, you know, again, being in more formal mental health treatment. But I'm a huge fan of, again, of just being, you know, mindful and checking in with ourselves, making sure that we're fully present, making sure that we're taking care of our kids, seeing people smile. Those go a long way.
I love those. And after this discussion, what are some additional resources that can be found online or in the Santa Cruz area for those struggling with mental health or for those who are looking to learn more?
Sure. Kaiser, we developed a strong relationship with the Calm app, CALM, and My Strength. Both of those have been really helpful for people who are, you know, trying to stay home and really haven't been out and about, but they need some sort of resources to be able to help themselves where they're at while sheltering in place. Of course, we live in a very tech-savvy world now, and so a lot of people are using their cell phones and their apps anyways. And then, you know, unfortunately, COVID and the, you know, pandemic doesn't care about some of these other major, you know, milestones that people experiencing, like, you know, births of loved ones, marriages, and unfortunately losses, right? And, you know, I think locally here in the Santa Cruz area, Hospice of Santa Cruz, which is not a Kaiser, you know, organization, but they're a really strong, really solid foundation to help people grieving, whether it's grieving someone who's been lost to COVID, or lost otherwise. So that's a very important local community agency. The other one is called NAMI, National Alliance for Mental Illness. So this is a national alliance, a national organization, I'm sorry. It's in every major county, but they are a grassroots organization that provide a lot of psychoeducation and mental health services and support for the family members who have someone who's suffering from a mental illness. They've converted all of their resources to an online format as well. So these are a couple of really solid organizations, not affiliated with Kaiser, that we would strongly endorse people to utilize here locally and in other places.
Awesome. And then are there any Kaiser Permanente resources in the Santa Cruz area that people can reach out to learn more about?
Sure. Yes, absolutely. So, you know, as I mentioned, we have 3 clinics. Kaiser has 3 clinics here. One is in the downtown area, you know, just down the street from the arena. We don't have any mental health services there. Our mental health services are based out of Watsonville and Scotts Valley. I should also note that due to the pandemic, we've converted all of our services to an online kind of virtual format as well. So we're doing video visits, we're doing telephone visits. We are still seeing people in person if we really find like that's what's the most important thing to do. We haven't stopped doing that. And so a person who has Kaiser does not need a referral from their primary healthcare doctor. All they have to do is call 831-768-6736, and that will lead them to adult or child mental health services. If someone is struggling with a drug or alcohol condition, then it's 831-768-6735. We're here. So, and you know, if someone's really in acute crisis, we want them to go to the local emergency room, which is either Dominican or Watsonville Community.
Great. Well, thank you so much, Rick, for joining us and sharing your expertise and insight with us. We really appreciate it.
Absolutely. I'm a huge fan. Thank you so much. Go Dubs.
And thank you all on behalf of the Santa Cruz Warriors and Kaiser Permanente for joining our CDUB Classics discussion on mental health today. The CDUB Classics have activities the last Monday of every month. For more information, visit santacruzbasketball.com/classic. Thanks all.